The coronavirus has mutated, and now a new study warns that the now dominant strain of the virus may be even more contagious than the original. So we want to bring in a doctor to talk a little bit more about what this all means. Dr. Ron Elfenbien is joining us now. Dr. Ron, you are an emergency care physician in Maryland. So the idea of the coronavirus or a virus mutating is, I don't think, particularly shocking. The flu virus mutates every single year. That's why we need a new flu shot every year. But what can you tell us about this mutation? As I understand it, there was sort of a different mutation in the UK, different than what we had here. And are we talking about the same thing? What was spreading in the UK, that version is now over here in the US?
Well, that kind of remains to be seen, and we're not really 100% sure yet. But it looks like this new mutation is more infectious, but not necessarily any more dangerous, which is great news for obvious reasons. But the fact that it's more contagious is worrisome. But it's not any more dangerous than the old, quote unquote, old strain. So that is something that we can kind of hang our hat on and say, well, at least that we got that going for us. But the fact that it's more contagious is obviously very, very concerning.
Mm-hmm. Doctor, there have been reports of a mysterious condition dubbed happy hypoxia or silent hypoxia when a patient who appears not to be in distress is actually found to have very low oxygen levels. Can you explain that? Have you witnessed this phenomena?
I actually have in the emergency room. It is very unusual, and nobody can really explain the pathophysiology involved here. See, what you're talking about is what we measure something called the oxygen saturation, which is the saturation of your red blood cells with oxygen. So if it's 99%, that means 99% of your red blood cells circulating in your blood have oxygen attached to them. For whatever reason, we're seeing people with 50, 60, 70, which normally you'd expect them to be dead. But they're awake, they're talking, they're playing on their phones, they're interacting with you. It's very, very strange, and nobody can really explain it. We have no explanation, again, because people with levels like that, with typical pneumonia or typical, any other kind of respiratory problem, would be dead or have serious problems. So the fact that people are just, as you call it, happy hypoxia and sort of interacting normally is very, very strange. And again, nobody can explain how this is happening. We really don't understand the physiology behind it. It's fascinating, but we don't understand it.
Would that explain, and you know more than me because I'm just sort of reminded of some anecdotal stories, would that explain why sometimes people seem to be not that sick and suddenly they sort of spiral quite rapidly, and we hear about these cases where, somebody was fine and then within a few days they've passed away?
That is a really, really good question. I think that's probably one of the reasons why people seem to be getting better, and they sit up, they're talking to their friends, their family, and the next day they unfortunately pass away or get really, really sick and need to be intubated, for example. So yes, that's certainly a possibility, and probably one of the reasons for that happening. And that's what makes this virus so dangerous, is that people seem to be getting better, and then for some reason we don't understand why some people just get much worse and end up either on a ventilator or sometimes dead. And it's really, really worrisome and scary, and we don't understand why. There's some theories that maybe this virus causes a hypercoagulable state, meaning you're more likely to get blood clots, and you can have a blood clot in your lungs, which makes it more difficult for you to exchange air and get oxygen to your blood. But again, nobody really understands why we're seeing this quote unquote happy hypoxia with this virus.
So you've apparently created this new device that helps protect healthcare workers that are treating COVID-19 patients. So I was wondering if you could explain to us what it is and how it works.
So I didn't come up with this idea. It was from open source blueprints on the web, and they've actually been used quite a bit in China and in Taiwan. So it's basically, as you can see that picture, it's a plexiglass box, and it has armholes. So what you would do is you'd put it over the patient's head when you're getting ready to intubate them, and you can put your arms through the armholes and reach in and perform the procedure. But the idea is it keeps the aerosolized particles, the virus particles that are coming out of the patient's mouth, from infecting everybody in the room. So we set up a nonprofit, we set up a GoFundMe to build these boxes. They cost about roughly $140 to manufacture, and then we ship them for free to any hospital who wants one. We set up a GoFundMe. We actually exceeded our request quite quickly, and we've gotten them out to hospitals all around the country. And we're encouraging anybody out there, please, if you want one, if you need one for an ER, an ICU, if you need 2 of them, 3 of them, whatever, please contact us. The website is helpthefrontlinesmd.org or .com, excuse me, helpthefrontlinesmd.com, and we will get you a box or two or three, whatever you need, free of charge. We just want to get them in people's hands so that they stay safe.
Doctor, that's amazing. I don't even know how you have time to do something like that, but I'm sure happy that you have and you're getting such a good response. I'm going to get you to repeat that that website again, but I want to ask you about this. You know, a lot of doctors and nurses have sort of started writing diaries to kind of chronicle what this whole experience has been like fighting the coronavirus. And there've been a number of reports about just how stressful this is for doctors and nurses, how concerned they are for their own lives. I've said before, the work that you do, it's heroic work, but I know that you don't want to be a martyr, and I'm sure your coworkers don't want to be martyrs, and also the concern for their own families when they come home. This is National Nurses Week, right? This is the week that we're supposed to be celebrating some of these frontline workers. What can we do, Doctor, to support and help people like you and your coworkers who are putting your lives at risk every day?
Well, thank you for asking that question. It is National Nurses Week, so people can thank a nurse. You can make them lunch. You can make them dinner. You can bring, in the emergency room, we always appreciate when people show up and say, hey, I just got some donuts for you, or I got some, some fresh pie or whatever, just something nice that people would appreciate, of course. But we oftentimes don't have time to eat when we're working, so something like that, even though it's little and seemingly insignificant, really means a lot to us. Or just a thank you card, people really appreciate being thanked. So just a card saying, hey, we appreciate what you're doing, thank you. Now, if people really want to help in a major way, making face shields, making masks, all that stuff is really, really helpful as well. And I would encourage people to kind of do that if you can, if you have the means to do that. And then, of course, just staying home. I mean, I'm less likely to get sick taking care of you if you're home. So you're not getting the virus. So please just kind of stay home and do your part so that we can go home and be safe and you can be safe. So people just please heed the warnings, heed the advice, stay home, don't interact with other people, physically. And please just try to stay safe so you keep us safe too. Because you're right, none of us want to catch either.
Very, very sound advice, Dr. Elfenbien, and certainly we thank you and thank all the nurses out there who are doing the very difficult task of going in to the hospitals and emergency care centers to look out for us. We really appreciate it from the bottom of our hearts. Thank you, Doctor.
Thank you. Stay safe.